hello, greetings, and happy Sunday. I hope you guys have had a great weekend. It's been busy here in the E-Rock household, moving and grooving. I hope you guys, like I said, thanks for tuning in. This is all about firsthand due diligence. So as we do the interviews, make sure you guys put your questions in the chat, because this isn't just for me. This is for you, the investor or the potential investor. So you could expect to hear from me again at some point this week. I think I might come on live on Thursday. And we're going to be hitting a regular schedule starting next week. So if you have any recommendations on what I should cover, make sure you reach out to me at buffalofiresidechats@gmail.com. I hope you guys are doing good. I hope you are great. So I don't want to waste any more time. We have an excellent guest today. He's been on multiple times. He's a wealth of knowledge. And sometimes when I have to paraphrase our content, I look just completely foolish, and you will lose IQ points. So that's why I bring him on the show so he can explain these things for you. And I know he's laughing backstage right now because I could see him. So I'm not going to waste any time. I'm talking about Mike Sheikh with Bioxytran, ticker BIXT. Let's bring him in. Mike, welcome back.
I heard that.
It's been a while.
Yeah, it has been. A lot of things happening, man. How you doing?
Doing good. Doing very well. Well, I've been following you guys, and I've been reading all the PRs, and we've been watching everything that's been happening with, the bird flu and just everything, especially with poultry prices and everything, in regards to eggs and yada yada yada.
Yeah, what are they up to now? Like $8 or something crazy?
Yeah. And you know what? It's crazy because you guys were PRing about this, almost 4 months ago. And I got to say, I did do the homework assignment. And so, there, guys,
if you could just...
a little sliver. And I want to put this in perspective for you guys. The poultry industry in 2024, they have an inventory of 518 million chickens and 224 million turkeys. That doesn't mean that's all they have. That is the rotating inventory. All right. So we're talking about billions. All right. Billions. And so if you could capture just a sliver of that, I think that would justify a stock being dollars and cents. But remember, this is not financial advice. That's just my opinion, especially if you're able to capture that. And given the science, and if it's able to do what you say it's going to do, then I think this is going to be a slam dunk. So I want to ask you, how big is the bird flu problem, and why is Bioxytran positioned to solve it?
There's this thing, bird flu. It's called, it's endemic now, which means, so I'm throwing around big words. What it means is it's here to stay. It's kind of like COVID. That's endemic now. It's here to stay. We can't get rid of this thing. You see, what happens, there's this viral reservoir, and it's in wild animals. And when it's in wild animals, it's not like we're going to go out and treat the animals. It's out there, and it's going to constantly threaten, our domestic livestock. Like right now, we got, I think I tweeted about this. We got birds dropping out of the sky. They're just going plump, plump, plump all over the asphalt. I mean, if that's a sign of endemic, there it is. But the other thing you got is dairy cows. And now we got bird flu in these dairy cows. That's basically threatening our food supply. So now this is kind of getting close to home. You can't have bird flu virus in the milk. And the state of California declared an emergency. Why? 75% of their cows, the cow herds, are infected with bird flu. It's like, this thing isn't going around. And then, we also got pigs. Pigs are getting bird flu now, but what's happening is they're not really getting sick. But what happens is the mama pigs, they're aborting their piglets. Well, that completely destroys the economics for the pig farmers, right? And now I'm tap dancing around everything. It's the chickens. They got to cull the chickens. And in the press release, I think we talked about, you could read through it, like how many chickens get culled per year. I mean, like one gets sick, they're like, oh, we got to get rid of everything. And the other thing is there's a crazy idea out there now, like, hey, let's not kill the chickens. Let's see what happens. Nah, not a good idea, because we did that back in the early 2000s. Now I'm giving you a little bit of a history lesson. We did that, and they did it in China, and it didn't work so well. And the thing that they were scared about is what happens is that they give vaccines to the chickens. What's eventually going to happen is those chickens are going to develop like a little bit of resistance and still pass it around and let the virus mutate, unseen to the human eye until it's too late. And then that virus wasn't effective with Tamiflu or whatever it was back then. So, we can't really do that. And you're asking like, okay, so what's our solution? Well, why not try a broad spectrum antiviral? Why not try it on animals? We got a good idea that it works on humans. We did our case study and all this, that, and the other thing. But it's not as easy as you may think. It's like, like taking something here and modifying it for animals. It's not so easy. But you'll see, we did announce that we developed a water-soluble galectin antagonist, and we think it's a pretty good idea. You see, because what chickens do, they're in these farms. What they do is they there's this little thing, and they just kind of put their nose and they peck at it, and that's how they get water, and they get water all day long. And so we think it's a pretty interesting idea of going after the bird flu that way.
Yeah. And, recently, you signed an NDA with the University of Georgia to evaluate galectin antagonists for bird flu treatment in chickens. Now, obviously, there's an NDA there, so I really can't ask you much. And by the way, guys, go back and look at their PRs from January on. There's a lot there. So what can you tell us about the nature of the work that you're going to be doing? Is it solely revolved around, like I said, I know you can't answer a lot of this, but is it solely around the bird flu?
There's a lot involved. I'm not, obviously an NDA is an NDA, and I'm not really working on it, but I could talk big picture. Big picture is you want to make sure that the delivery method is going to work. And do you have to do it on chickens? We got to adapt this thing for chickens. So, I think the first thing is, I really can't get into how we're going to do it, but the first thing is making it and then testing it. So, so I'm not going to get deeper than that, but we'll make it, test it. But the thing is, what I will tell you is that chickens that do get bird flu, it doesn't take them long to die. It's like 3 days. So what I can tell you is I don't think it's going to be a very long trial.
Got it. I'm looking forward to seeing your progress there. Now you met Nobel Prize winner, tongue-tied there for a second, Carolyn Bertozzi. What was her take on your tech?
I've met her twice, actually. Once was at the JP Morgan, and the other one was at the Precision World Medicine Conference. And the truth is, on the Precision World Medicine Conference, I kind of stalked her a little bit, in the sense that I went down there because I wanted to meet her. And, I got my 20 minutes with her because what I was interested in doing was getting a collaboration with her. So what did I do? I pitched my tech. And did she follow me? Yes, she completely followed me. And she understand what we were doing and how it integrated with what she was doing. And I've studied her tech. And you know what? If you look at one of my slide decks on cancer, you'll see her tech is actually in my slide deck. And I explain that too. It's her tech revolves around Siglex. But anyhow, the bottom line was, after we had talked, and she's like, so what's your ask? Well, I want a collaboration, Mike. I'm highly conflicted, and there's no way I could ever endorse a galectin antagonist. Now, some people in the audience may be like, oh my gosh, that's awful. No, it's like let me translate this for you. It's like the biggest compliment you can get. And I got to tap dance around this the right way. It's basically saying your technology really competes heavily with what I'm doing, and I cannot bite the hand that feeds me. That's really an accurate translation of what she just said. I don't know if that helps you. But it was a refreshing conversation. Then that comment kind of led to like I figured out how much influencers get paid, and it wasn't going to work. We couldn't afford something like that. And I also found out she's into some really cool stuff. I mean, she's talking about taking drugs through the blood-brain barrier, like in little tiny parts, and then they reassemble. I mean, she's brilliant
Crazy.
scientist, great stuff. But unfortunately, no collaboration there. But we got probably one of the I feel greatest endorsements of the technology I could ever hope for. No, I'm highly conflicted. That was a highlight for me, actually.
Wow. You've been attending a ton of investor conferences lately. What are your key takeaways from the recent conferences?
Let's talk about one that I saw, like our competitor. One of our competitors is a company called True Binding. And, I have a personal connection to this because they're going after Parkinson's and Alzheimer's disease. My dad, he passed away with Parkinson's, and I knew way back then, I knew galectins were involved in that disease. I read about it, I studied it. I was like, oh my gosh, if I could give my dad a galectin antagonist. So when I saw their data, it goosebumps through my veins. It's like, we really have something here. So they have an incredible galectin antagonist. Now, theirs is different than what we have. They're using a galectin-3 antibody, and it's able to penetrate through the blood-brain barrier. So it's pretty cool what they have there. Have we signed an NDA or anything like that? Not yet. You never know. We'll keep that open item. I also met and pitched Medium Pharma. One of them was it was in ophthalmology. That's basically eye diseases. You can look into all the ways that you can treat eye disease using galectin antagonists. And by the way, I gotta tell people something. Look at my Twitter. I put breadcrumbs out there for people to see. So when I tweet with a purpose. I just want people to know that. And the other thing is, I found and I networked with a lot of people. I'm trying to get business development people at these big pharmas. And if you look at my latest presentation, I revamped it. It's the investor presentation. You're going to see this laundry list of basically big pharmas for cancer, immune checkpoint inhibitors. That's my list. That's my list. And then the final thing that I think is really cool, and I don't know if you want to talk about this, but I got involved in a mentoring program with the students from Arizona State University. Wow. And what's so cool is what they're doing, and we get a research report out of them like the beginning of July. And what we're doing here is we're reading, or we're basically looking at the impact of what's called a validated galectin-3 staining test on big pharma and the ICI checkpoint inhibitors. And the checkpoint inhibitors are probably around 50 billion annually in sales. And what could a $2 to $3 million validated test do to disrupt that industry? That is exactly what my students are going to be talking about. Wow. So if this makes it in front of Congress, the healthcare people, the big pharmas, it gives me a tool to beat them over the head. And want to know why you should talk to me? I got 50 billion reasons why you should talk to me and why you should look at this technology, which has gone under the radar for far too long. But yeah, lots of networking at these not at these conferences in general.
When that report comes out, I'd love to have you on to break down the BFC version, because that's going to be remarkable, and for the students too. What an experience to be able to do that with you as well.
Yeah, I've been talking to them and telling them they're jacked up. We've had like 2 meetings so far, so they're jacked up, and hopefully I can keep that momentum going.
Good, keep them enthused.
Yeah.
Well, I want to talk about, we all know about government funding lately, and there's lots of government cuts. And you did announce this back in January, that you announced government interest after initial BARDA Tech Watch Light meeting. So are these options still on the table for you, even with the cuts that are coming?
The truth is, I have no idea. Okay. Which way the wind blows in the current administration, no idea. But I can tell you this: we talked to BARDA, and they really don't have any money except for one thing: influenza. And I followed on with the DTRA, and they don't have money, but they might, if it's something for like influenza or Ebola, but definitely, there's no one looking at COVID, but this whole bird flu thing is starting to, if it jumps to humans, they're still looking for something. And, you know, just recently, like I think Thursday or Friday recently, there's this new government grant for $100 million in funding from the USDA.
Wow.
And you know what it's for? Poultry. $100 million for poultry. And let's face it, the new guy, the JFK guy, he doesn't like vaccines. And there's this company that this just hit the news like this past week too. There's a company called Vaxart. You can pull it. I'm not going to say you should pull it up, but you can pull it up. They lost $500 million from HHS for the Project Next Gen to find a COVID vaccine or something like that. And I'm thinking of like, did you hear about me or something? I don't know, but the bottom line is, I think the pendulum is starting to swing back away from these vaccines into, why aren't we looking at therapeutics? So on that,
you might be in the right place at the right time. I mean,
yeah, on that announcement for $100 million in funding, yeah, I think we're going to pounce. We're going to pounce on that, because I don't know anyone else that's got a better shot. I mean, phase 2. I mean, we just need to rejig we had phase 2 data in COVID. So, I mean, it wouldn't be hard to rejiggle this trial and get ready for bird flu. We're not going in that direction. I'm not trying to mislead people. I'm just saying it wouldn't be crazy for us to try to get a grant going in that direction.
I think that's a good idea. If it's so good, why is it so cheap? I mean, you beat Pfizer's Paxlovid in trials. Why hasn't Wall Street taken notice of you guys?
Good question. Pfizer's the 500-pound gorilla. When they came out with Paxlovid, everyone's like, yeah, COVID's fixed. Have you seen their data? I mean, and have you seen our data in comparison to theirs? And first of all, we can't compare. And the reason we can't compare is because it's unfair to us. But hey, let's take out the handicap and see how we do. At 30% PCR negative in 1.5 days, if you look at the charts for us, and you compare that to 20 days in real data, and you just go like, do I want to be sick 2 or I want to be sick 20? I mean, at the time the FDA's own measures. Now, has PCR negative changed? And I don't know what the new endpoint is, but way back then, we had that data. It was unfair to us, and we're just going like, guys, pay attention to us. No one in Wall Street noticed us. And I think right now, no one really cares about COVID, even though we have a solution. But I want to just get this out there. There's no like conspiracy theory out there where the regulators are getting to us. We simply haven't had any money or funding to do what we want to do. We hope that's going to change real soon. But there's also this investor perception is that we're all about COVID, and we're not. I mean, did you not see our patent on 60 plus viruses? I mean, there's more to us than just COVID. Anyhow, Go ahead. Yeah.
No, that's true. And so I know we've talked about that multiple times. We've talked about, the inflammatory disease. We've talked about a lot of these things. But let's get back to like the sector itself. The biotech sector has been in a brutal bear market. There's certain sectors that are getting hit hard. You guys are getting hit really hard. How has it impacted you guys specifically?
Well, it's harder to raise money. And, we had this bright, I don't know if you realize this, but at the height of this bear market, there was 160 biotechs that were trading at massive discounts to cash. I mean, the cash is worth here. And what's a company worth? Well, it's value plus future earnings, right? I mean, they just discounted everything. Um, so we're I was thinking, and this was like a year ago, hey, why not partner with some of these guys? Now, the challenge that I figured out was what I got to do to partner with these guys. I got to explain why my science is so good compared to theirs. Well, that's like saying, oh, your baby, mine's beautiful, more beautiful than yours. So you're basically calling their baby ugly, and you just can't do it. That is not a way to win friends. Okay. And I think that has been a challenge, at least, for us doing a deal. And right now, the whole environment for other biotechs, they're doing nothing but toxic deals and warrants and this and that to raise money. And you know what we've been doing? We've been saying, you know what? We're looking for this specific investor who's interested in our science, not interested in some sort of structured deal because our price isn't where it needs to be. So we've been fighting for investors, and the truth is, why am I fighting so hard for investors? Because my interests are aligned with investors. My compensation, since we haven't had any in years, is tied to the stock price going up. So I'm aligned, and all our management team is aligned with investors. Um, so anyhow,
Yeah.
we'll leave it at that.
Well, and you got to ask, does the price, and you guys could ask yourself this, with many stocks, does the price always equate to value? Or is this an opportunity of a lifetime? Is this an opportunity at the ground level?
I
And
think it's an opportunity at the ground level, and that's what I've been banging to people. And I've been looking at private investors, I've been looking at fund managers, and I don't want to do a deal down here that doesn't make sense. We did a deal with private investors a couple years ago. I think it was like 3 or 4 years ago, actually. And we did it at what we thought was a stupid cheap valuation, and right now that would be around 25 cents. So I mean, I hate doing a lower round. You know what I mean? It's
Mhm.
just, it doesn't make sense.
Yeah.
But sometimes you got to do what you got to do. And I'm not saying that's not a forward-looking statement. I'm just saying that's kind of where we're at with things. So one helpful thing that I just want to point out, when you look at valuation, it's all relative. Does anyone remember what Moderna was? How great their technology, the mRNA vaccine, and how huge it was going to be? That was trading at $460 a share. Anyone know what it's at now? 33. Okay.
Unbelievable.
So price is great. Oh, it's worth that much. Sometimes it works in reverse. So sometimes that was too good to be true, right? And
Hmm.
then, now we're down here, and we're saying we have all this technology. Sometimes maybe this is too good to be true, and the price doesn't recognize it. So sometimes the market is inefficient, and I really believe that the market is inefficient.
Yeah, and you know what? You go through your phases where things are overvalued, things are undervalued, and and I think we're, with many stocks, with many companies, we're in the position now to really double down on gems that have a lot to bring to the table. The last 18 months have been pretty brutal, and you know what? And I'm going to tell you guys this: if you have conviction in a company, let's say you're following BIXT, and you've been following the science, you've been following the PRs, you've been watching the interviews, you've been watching his presentations on emerging growth, you reach out to them and ask questions. If you have a conviction for the science and the stock and the company, then you're gobbling it up and you're buying it because you want to buy things when they're beaten to tar. You know what I mean? It's easy to buy any stock, when everybody's excited and the bull run's going and everybody's getting, everybody's in that mood. But it's hard to like get in that mindset. And I'm in this mindset now. Is like we're beaten down, I'm buying it. I like this one. It's beaten down. I'm going to buy more of it. And so, yeah, I agree with you there. And I think it's just you have to ask yourself, overvalued, undervalued. I want to break down the science a little bit.
Okay.
We got to cover this stuff, guys, right? So I want to ask you what exactly the Galactin Challenge is. Now, you did share a video with me, and for some reason I couldn't pull it up, but why is it key to chronic disease?
Well, the Galactin Challenge, you could actually go on right now and you can go onto your screen and type into Google anything, like any chronic disease. So you type in a chronic disease, and then what you do is you type Galactin 3 after it. You know what you're going to find out? It's like one of two things, okay? This is an incredible biomarker of this disease, or you're going to see, we believe that this is what the journal article is going to say. We think that this is an ideal treatment method for a galectin antagonist. And you look at this and you see this 14,000 times, and you think to yourself, maybe they're on to something here. And you think to yourself, why have they not developed a galectin antagonist yet? Well, we're starting to see that momentum. There were only like 2 players in the space. Now there's 3, now there's 4, and now I think there's probably 6. It's starting, folks. And when you go into the space, what do you want to do? And this is for anything. You want to look, who's the company that's best of breed? See my hand? Who's the company that's best of breed? Who's the guy that came with who coined the name Galectin? That happens to be our CEO, Dr. Platt.
Well, yeah, I mean, he coined that, and this is going on 30 years. And the fact it's flying under the radar is ridiculous. And we're talking about 14,000 published journal articles. 14,000.
Yeah.
That's crazy.
Someone's going to notice. So anyhow, we'll see. We'll see what happens. But that ties into what my Galactin Challenge is. You can put in Alzheimer's disease. You can put in psoriasis. You can put in atopic dermatitis. You can put in almost any cancer. You can put in fibrosis, heart disease, stroke, neurodegenerative diseases. I mean, I could keep going. Heck, you could even probably put in ALS. These are all chronic diseases, and type the word Galactin 3. See what it spits out. And then you say, is this guy for real? You see, what I have to do is I can't really talk about this stuff, because if I do, people look at you and go like, you can't tell people that. As a matter of fact, that brings me back. The one tidbit that to my Carolyn Bertozzi talk, and she says to me, Mike, one thing I want to tell you about is that you can't talk about how good Galactin science is. You got to really tone it down when you're talking to these investors, because they think you're crazy if you start telling them all these other things that it will do. But the reason I point that out is because I got a Nobel laureate counseling me on the fact that she understands it works on all this stuff, but says, hey, just a little bit of advice. You can't say that when you're pitching these guys, because she's done that before. She understands her technology and how breaking it is and how it can apply to almost anything. And she also understands ours. So that was a little aside that I was excited about.
It's the phrase, if it sounds too good to be true, then it probably is. And investors, we always have that in the back of our mind. You know what I mean? And so, me, like sometimes we'll have a conversation, and I get goofy sometimes. Or like I'll talk to any CEO of them. I'm like, all right, let's tone it down. I've heard these things a bunch of times. I think I was talking to you that one day. I was like,
yeah,
I've heard that from every OTC CEO. But the truth is like, and that I think she was smart for that advice, because sometimes that could be like a red flag, because lots of times
exactly
there are scams out there. There are like, oh, you know what? This is too good to be true. Then it probably is. But I think bio's different because you have the tests, you have the data, and you have
you can
all those things going for you right there. You have hard, tangible evidence of the Galactin antagonist. That's unbelievable.
Erock, we don't do research in Galactin science at our company. Why? Because it's already out there. We just take the science, and all we do is we apply it. I mean, we've already seen the research on cancer. I just told you, I went to True Binding, saw the research on Alzheimer's disease, on Parkinson's disease. We all have, it's the same target. And the only thing different about my company or our targets versus everyone else is that we use something called nuclear magnetic resonance imaging to make sure that our drug actually does in fact bind to galectin-3. I don't know if these other companies have done such, but what that means to the investor is that perhaps anything that they've done, we could do.
Okay. How does your science compare to Big Pharma's existing solutions?
How does it compare to Big Pharma?
How do you have the edge, would you say?
You know, big pharma, we don't really get to translate with big pharma, and that's the hard thing to do. Is right now I have decks ready to go to big pharma, and I've talking to big pharma, so I don't know if that's breaking news or anything, but you know, I'm talking to big pharmas plural, and I have decks ready to go, and you know, they're a tough animal, and everyone has their little onboarding process that they take you through, and I'd love to discuss that more. But you know, how do we compare to them? You know, it's a dandelion theory. Okay, the dandelion theory is what we want to do is we want to take disease out by the roots. Okay, we're looking for cures to disease. And if you look, that's what, you know, galectin science is about. We want to hit the underlying disease, and the underlying disease and target of galectin is what, guys? It's not COVID, it's not cancer, it's inflammation. Inflammation is the central idea in almost every chronic disease. So galectins are the apex predator of inflammation, and that is what we target. So we're more of an inflammation company than anything else. So, you know, hopefully that's how we compare. But, you know, it's back to the dandelion theory, is what the drug companies want to do is they just want to rip the dandelion out by the head, by the top. That's it. Okay, well, that helped. Well, dude, the underlying disease is right down there. You know, you didn't get it, you know, and that's what they're doing. And that's how we differ from big pharma. Is we're about pulling the thing out by the roots. Does that make sense?
It makes total sense, man. I'm telling you, it's really remarkable when you start. And I'm by no means well versed in the medical field, but I read things, and you know that correlation with inflammation, chronic diseases is there, and it's proven to be there. But let's talk. I know a lot of people that are going to watch this and are watching right now want to talk about the stock. And by the way, Doc, I'm going to get to your questions after in about 5 to 10 minutes. Give me a second. I'm going to pull up your questions because you're putting some good comments in there. Let's talk about the stock itself. Now, look, this is your 3-month, 1-day chart. We have approached the golden cross. Now, this, like for somebody like me, I like to see this because this is when I like to load in. Because I don't know, well, that's a very, very good sign. And so right now, with all this happening, you got good stock movement. It looks like you're uptrending at this point. You know, I'm asking myself, all right, is this just gonna dump down? Is this just an anomaly, or is this something that is going to push us in the right direction and get towards that $1 to $2 mark? Because the truth is, your share structure is beautiful, and not only that, you did talk about your debt. And I want to talk about that. The Bioxytran secured the 1.6 million SPA to extinguish the note and fund clinical development, be purchasing all convertible note overhang, funding preclinical and clinical trials, management for fitting $460,000 in accrued payroll. All right. So, you know, you're putting your money literally where your mouth is there. So I want to ask you about, like, why has your stock been flat for so long? I think obviously we covered a little bit of why that's the case because of the brutal bear market that we're having. And what changed recently? And also talk about, you know, how much did your convertible note, the convertible debt, suppress the price discovery? And where do we go from here? Because this is a prime opportunity chart-wise and news-wise, because you guys are out there, you're transparent, you're always sharing what you need to share. Everything, comment on everything I just gave you.
So the stock has been flat for a really long time, and basically 2 years. And over those 2 years, I've done everything that I could to try to, you know, get some people in to take out the convertible debt. But, you know, some of our investor groups that we have 2 major investor groups in our company. they just didn't have the liquidity event, and they want to invest in our company, but they haven't. And then we had the third one, which is the Triton funds, and that's the press release that you just mentioned. So our stock for the past couple years, it's been worth what the convertible note holder thinks. See, what happens, and I'll, hopefully this kind of connects the dot for some of the shareholders out there. The reason we went nowhere is because the stock is worth what the convertible note holder says it's worth. He's been doing 90% of all the stock volume over that period of time. So again, what's it worth? Whatever he says it was. And then I guess what investors kind of missed was me pounding the table in early January with the news. And the news, basically, they didn't read the fine print. We basically, for all intents and purposes, had their convertible note holder locked up for a period of time while we're doing this funding with Triton. And the funding with Triton, some people said, oh, it's done. No, it wasn't. It wasn't done. We have the option to choose that funding. And obviously I can't comment right now whether we have or haven't or anything like that. You got to wait for the press release. But anyhow, I guess the point is, we've been hampered by that consistent selling. And I guess people in early January, when I announced the news, they didn't realize that the overhang was gone. And now with this recent, boom, they're realizing, wait a second, this stock is thin. I told you that in January.
Yeah.
And certain people that did listen to me, now they're feeling the benefits of that. And, part of that was me pounding on the table and say, guys, we have an opportunity to take out this debt. We need the stock price higher because at 7 cents a share, the math doesn't work. I can't do it here. I need the stock higher. And, you need to average down. And I guess some people just average down. So I think that was part of, the reason there. And I think the bird flu news and, that helped things a little bit as well.
Yeah, so, no, I agree with that. And it seems like with the share structure that you have, I mean, if you get any significant buying, any significant amount of dollar volume, you're gonna move hot. And so it looks like this could be a new era for
So
you guys.
You know what I like to call this period or this era? It's called price discovery. And you're like, what the heck is this guy talking about? What happens is when there's no overhang, we get this incredible volatility. And if you pull up the chart, you're going to see it's just bouncing all over the place because people are trying to figure out, well, what is this company worth? Can this company raise money? Can they continue with their development? All these questions are going on in their head. And that's, so any little tidbit of information comes out and you're going to see the price discovery mechanism working. And I don't know where this thing's going to end up evening out or anything like that. But one thing I can expect is more volatility while people figure that out. And while people figure out, I think people have figured out there's no overhang to this.
Wow. Yep. I'm excited for it, especially looking at the chart. Like I was just saying, let's get to some comments. I'm just looking at some of these. What flavor vape pen is that? Blue? This is a note pen. You get high on the knowledge. Let's get to some of Doc P's questions because he put out some really, really good ones. Cattle, cats, and humans now catching H5N1, bird flu. So a positive bird flu trial would also make it a perfect choice for humans next.
Bingo. What you do is you normally do it on animals first, and then you prove it in humans. This is a little bit different. We've kind of proven it in humans, and now we're moving to animals. And I was and on that, there's the World Health Organization. I was just on a call last week, and they call like Baxaville, I bastardized the name, but Zofluza, okay, is the common name. They said, oh, that's a broad spectrum antiviral. I'm sitting there going like, that's not a broad spectrum antiviral. If that's a broad spectrum antiviral, what we have is like a world spectrum antiviral or something like that. I'm like, no, that's not a broad spectrum antiviral, but that's their mentality. It's a broad spectrum antiviral. So if it works in influenza, it's also going to work in bird flu, right? Well, what did we do? We did a test, in vitro test on influenza, and now we're doing it on bird flu. So if we were to, I can't talk an NDA, but if we were to do anything, do you think we're testing to see if it works on bird flu? Yes, we are, but we're not doing in vitro tests on it. We almost don't need to, and I don't know if people realize that. So we proved the broad spectrum activity in people, although we've done it. I can't say that we've proven it in people. We've done it in vitro in 3 different viruses, and we understand the mechanism of action. So we're very comfortable that it's going to be broad spectrum antiviral, and that'll allow us to possibly do clinical trials where you do it on, instead of just COVID-19, you expand the indication. And actually, our clinical research organization told us, hey, you should go after other things besides COVID-19. So because RSV and influenza are also out there, and I think influenza, it really showed its head this year.
Doc P.
Did I answer the question?
Yes, it does. Investors thought Google and Amazon founders were nuts in the early days. You got to find the good ones early, and that's true. So what's next for you guys? What's next for Bioxytran?
Well, like immediately you can kind of see, we struck a chord with the bird flu thing. So we need to figure out if we really have something. And I don't know if that's going to be in days, weeks, months. I can't give you any element of timing on it, but I want to tell you is we're pushing extremely hard. And, if you think that, we're only going after one academic institution, think again. But now the other thing is our antiviral tech, it's big. And right now, we have a patent, or patent pending rather, on 60 plus viruses. I want to know more about that. I want to know how many more. How far does this go? I put out a tweet and I said, look at this. We've had activity in 4 different viral families. How many more can we prove this in before investors wake up and realize, well, wait a second. This thing could work. We don't know how many viruses this thing can work on. But investors are asking that question. How big is this going to be? So we need to do more in vitro testing. And then we need to do more clinical trials. I think investors really want to see us moving the trials forward because we've done nothing. And all this takes money. So hopefully we're on the cusp of money and we get to do this. And the other thing that I've been working on are partnerships. I'm going to these conferences, I'm networking, we're doing presentations, we're going, we're looking at partnerships. It's how to structure them. It doesn't come overnight, but we're definitely making progress. And it starts with, your marketing collateral and making sure you're able to communicate in their language. And, that's probably the biggest learning process that I've had. And I'm getting traction.
That's excellent. So
partnership, funding, clinical trials, antiviral tech, bird flu, you name it.
So we have the study that you're doing with the school. We have the NDA that you signed. We have, you have a lot of stuff going on, all the connections that you've made, Nobel Prize winners. Dude, you're on fire and you're doing everything you need to get out there. So I am going to be watching the stock. This has been on the BFC watch list almost 2 years now. You've been on the show, I don't know, 4 or 5 times. It's been great having you on tonight. And I just want to say thank you for being a part of the Buffalo Fireside Chats community, man. It's great having you here.
Thank you. No, I enjoy it, you rock. This is fun every time I do it.